Thank you. Good morning.
Good morning.
Again, I'm Stephanie Berglund. I'm the CEO of THREAD, and THREAD is the Alaska's statewide child care resource and referral network. So most of your states have CCR&R networks and agencies, and we all have a mission across the country to help advance the quality of early care and learning and child development by working with families and by working with early care and education programs, both with early education professionals and with those community-based programs, and working with the community to help, and you all, to help with advancing our systems and come up with some problems and solutions to these very complex issues that we've already been hearing so much about this morning. So I'm really delighted to be here, especially as a resident. So I don't want to speak for all the Alaskans in the room, but we welcome you. And I live and work here in Anchorage with my family. I, of course, work in early childhood. I have a 9-year-old daughter who will be leaving early childhood now and entering the 4th grade. And I have a husband here who works in a local high school teacher. So I'm proud to be here representing the education continuum here in Alaska for my whole family. So I was asked to talk about a slew of things. One is, why is early childhood important? And to give some state examples and use Alaska as an example of where we are in our programs and practices in early childhood. So those are both large presentations. So since I wasn't allowed to have 2 slots of time, I'm going to try to squeeze all of that into one here. So we've been talking about when is it important to begin investing in the education of our young children? And I like always to start with this frame of mind that all of our work that we do as early care and education advocates and supporters in Alaska comes from the frame of reference that young children are learning from the minute that they're born. So no matter where they are, and the controversy, as Bruce was saying, whether they're best served at home or are in an out-of-home community-based setting, we know that they're learning, and that's something that we need to all be considering, that this includes children starting from birth. So I'm going to save you here with your map. And to start, I was going to pipe in and tell you that, but so you can thank me later. So I want to give a little bit of context of Alaska, since I was asked to talk about what early care and education looks like in Alaska. And as you all know, we are far away, and we're the largest state geographically in the United States, but have a small population of just about 730,000 total residents. So that's pretty small. You have been here visiting in Anchorage, so 40% of our population lives here, and the rest is, then throughout the state, many in very small villages with just 100 people. So there are really strong differences in Alaska between our rural and urban communities. So many of our very small villages still are only accessible by aircraft, and many don't have modern plumbing. There are other challenges for children as well. Children across the state, including in Alaska, in Anchorage, but especially in rural communities, don't have the same exposure to real life. Now with access to TV and cable and social networking, there's sometimes a skewed reality of what our global world is looking like. So we work really, really intentional to introduce our children to what life is like in our world and communities outside where they live. Our state struggles with, unfortunately, a lot of really high numbers of the bad statistics. We struggle with high rates of substance abuse, domestic violence, suicide, and child abuse and neglect. So because of our distance and trouble with access for services, we have some unique challenges for all of our education services, but especially for early care and education as well. Somebody asked me earlier, I'll also reference our economy. Someone was saying, well, how is early education paid for? And I'll talk about that in a second. But I think what's challenging, too, is Alaska is also a really young state. We're just 55 years old and are heavily reliant on our revenue streams of oil and gas and from the federal government and also from tourism. So we're really happy you all are here. But but we don't have diverse tax structures and have limited resources to work with as we're looking at developing support. So I bring this up as context of just about the uniqueness of Alaska, but also the characteristics that impact how we best serve our young children and education throughout the state. So who are Alaska's children? We have about 60,000 children under the age of 6 across the state. You heard some poverty statistics before, but I'll just mention that demographically, in terms of labor, that 63% of those children have all of the adults or their parents in their household working in the labor force. So I don't think that's a surprise. I mean, we're seeing that as a national trend and statistic that more and more of our young children have both or all of their parents in the workforce. In addition to this, 15% of children under the age of 5 living in poverty. If you consider all of our children under the age of 17, we have a rate of 27%. So we have just over 50 different school districts in Alaska, and just in Anchorage alone, there are 100 different languages spoken. So we're a very diverse community and state, which has great opportunity, but also brings with it challenges. So I want to just give a picture of where our young children are being served. So I mentioned that we have about 63% of our young children who have all of their parents in the workforce, yet we just have about 32,000 regulated spaces of out-of-home care for them. So we really only have about 50% capacity of the potential need for where we're serving our young children. The largest portion of them, which I think is probably true in many of your states, is in private or public licensed childcare. So we have 23,000 children across the state who are in regulated childcare. Next is Head Start. So between early Head Start and Head Start, we're serving about 3,000 children. We have 2 different preschool models in Alaska. We have school districts who are using discretionary funds and Title I funds to serve their preschool children, and our state is investing $2 million in public pre-K to serve 291 children. Children are being served through early intervention, our Part C programs, and also our Parents as Teacher home visiting programs. And an additional 22,000 children are being served at home through, we have a strong literacy program in Alaska run by Best Beginnings, which we're using the Dolly Parton Imagination Library. So if you're not familiar with the Dolly Parton Imagination Library, it's a great program. Yeah, it's in Tennessee from Dolly Parton. And we all know Dolly Parton, but it's a great program where it's a free book delivered to children's homes each month for children to build their library, engage with learning, and develop some of those pre-literacy skills that we know are so important. So our current investment in Alaska for early childhood is largely driven by private pay families. So this is really, I think, a big debate and something that is helpful for you to bring home and be considering in your state of, I think there's strong opinions on whose responsibility it is and who should be paying for the early care and education services that our young children need. So childcare is expensive. I don't know if any of you in the room are paying for childcare or know of your grandchildren paying for childcare, but it's extremely expensive. For example, here in Anchorage, the average rate of infant childcare is $1,000 a month. So that far exceeds college tuition in Alaska and in many states. So it's extremely expensive. So as the previous panelists were talking about that, as we have very rooted, I guess, financial systems for our K-12 systems and our higher education systems, we still haven't figured out a strong financial system and structure for early care and education. So there's huge opportunity in that. It's exciting that more businesses and foundations are coming and joining us at the table to talk about innovative ways to fund this as supporting our young children, but also as a community solution that we know is so important. So I wanted to turn now to highlight some of the programs and practices that we have in Alaska. And I have a slide for each of these. So when we think about the science and research, and these panelists have talked a lot about this already, But I want to just hone in on, and if you're not yet familiar, encourage you to be familiar of, in the last decade, the new brain science that has been coming out and the strong longitudinal studies on the investments in early childhood and how those longitudinal studies are making a huge difference and have that high rate of return. So I'm not going to repeat some of that we already talked about, but we also talked about, and I was happy that it was remarked on in the earlier in our opening remarks, that we now know that when it's hard to define quality and that we can link quality to the number one indicator of the child's teacher. So again, as we were saying in the opening remarks, I think if all of us think back to a teacher that was really influential in our life, we know that investing in our very young, early childhood teachers is important because that continuity of care, their skill and development and knowledge of early childhood is critical in delivering services. We're also using ACEs to guide our work, so I'm not sure if people are familiar with ACEs. I encourage you to be familiar with that. The ACEs is the Adverse Childhood Experiences Study. So it's a study that is in partnership with the CDC, with Prevention in Atlanta, Georgia, and the Kaiser Permanente. And they have been doing studies related to trauma and how trauma translates to risk factors important for our young children's development, but all of us as individuals in our development. So that is some of the research that is guiding our work and decision making here in Alaska. Another piece of research, if you haven't heard about it yet, is the 30 million word gap. So this is pretty astounding, and I know that Renee talked about this earlier too, of what the differences are between children who are growing up in more affluent families versus poor families. And by the age of 4, they're hearing 30 million more words than low-income children. So that is largely significant, and that's why we're encouraging families to be reading with young children. We know that exposure to more words obviously supports better development of conceptual knowledge, like vocabulary, understanding of narrative and story structure. It's also that phonological awareness and letter knowledge that leads to literacy. So now that we have that research, all of us have huge opportunities to figure out how to put all of this in action. So in Alaska, we have some great collaborations and partnerships working to advance this work. Bruce already talked about the coordinating councils. So this is the private-public, state-level council that guides early childhood work in our state. So as he said, I encourage you to be familiar with that group in your state and to be involved. Our group has been meeting since 2011. We have a report with recommendations in 2012. And because of our authority or lack thereof, I should say, we have yet to see appropriations supporting these recommendations, but those recommendations have remained the same over the last few years. We also have the Alaska Early Childhood Advocacy Group. This has been a collaboration of early childhood advocates and partners working together to have consistent messaging and advocate for consistent priorities each year. We've been meeting since 2007 and have been furthering our public policy efforts. So that group is made up of our Head Start Association, THREAD, where I work, Best Beginnings, our Alaska Association for the Education of Young Children, our Infant Learning Professionals Association, and Parents as Teachers. We're also growing in our school district collaborations, and Bruce talked about this as well, that we're working more with our school districts in conjunction with who are the early care and education providers in that catchment area to help build that bridge. And we have two exciting Anchorage initiatives that I wanted to point out. One is called the Anchorage 90% by 2020, and another one is Arise. Both of these are both Anchorage-specific initiatives that are using a collective impact model to help create positive social change for our children and our community. So what's great about both of them is they now encompass the full continuum of cradle to career. The 90% by 2020 initially set out to focus on our graduation rates with a goal of seeing 90% of our graduates graduating by the year 2020. That's now been extended to include early childhood, which is really exciting. So there are similar aligning goals that we aim to have 90% of our 5 and 6 year olds entering kindergarten ready. And the Arise group is a similar group focused on the success of our Native Alaskan children. So that group is supported by our Cook Inlet Tribal Council, our local United Way of Anchorage, and also our school district to help Native children successfully enter school ready for success. Some other positive outcomes in Alaska's programs that are in initiatives include, I talked about Imagination Library a little bit. That's supported by Best Beginnings, and I'm glad to see folks here from Juneau because I have some great statistics I wanted to share about the positive results of Imagination Library in Juneau. So while we can't make a direct correlation, it's pretty exciting that so for parents who have children who have been enrolled for more than a year, we're seeing great information coming out that their children, of course, have greater interest in reading in books. There's more books in their homes, and they're better prepared for kindergarten. And so we just had, for the first time, looked at our developmental profile numbers of how, if there's been a correlation or some similarities between the indicators of learning, communication, language, and literacy. So since 2009, those indicators have increased by 11%, and at the same time period, the enrollment in the Imagination Library went from 12% to 76%. So again, I don't know if there's a direct causation, but it's pretty exciting that there's more early literacy, books in the hands of kids and young children in Juneau, and we've seen that change by 11%, which is really exciting. There's also some more intentional work happening among public-private partners to make some investments in partnership. So one example I wanted to highlight is a breastfeeding initiative actually Thread's been participating in with the state of Alaska. We all know the health benefits of breastfed babies, and the largest drop-off of when mothers stop breastfeeding is when they return to work and when their babies enter childcare, so that's not a huge surprise. So we've been working with businesses to support nursing mothers, and have also been working really closely with early care and education programs, ensuring their classrooms are set up to support nursing mothers, and educating early childhood teachers so they can be supporting mothers as well. So that's a really exciting initiative that we're happy to be a part of. And I also wanted to highlight strengthening families. So I should have put on there, but so our Early Childhood Comprehensive Systems Coordination in Alaska is really leading the efforts around strengthening families and our work on trauma. So strengthening families is also a national initiative that has taken off greatly, I should say, in Alaska, and it's an initiative focused on family strengths and building resilience in families to really ultimately reduce child abuse and neglect. So at Thread, for example, we've been working closely with 22 early care and education programs across the state to embed strengthening families. So I want to highlight a few successes of that, but let you know that it's built off of 5 protective factors. So it's built off of parental resilience. It's built on concrete support in times of need. Social connections for families, knowledge of parenting and child development, and it's also focused on their child's social emotional development. So we know that when we're focusing on these protective family factors and focusing on strengthening families, that's making a huge difference. So there's one child care program here in Anchorage who's been implementing the model for a while, and they were trying to figure out how to engage their dads. And they were saying, we have dads do drop off and pick up, but it's kind of sporadic, and they don't seem to connect with the teacher as much. They kind of do the quick, here's the backpack and leave. And so they were saying, how can we engage dads? And so they kind of picked a day of the week where they encouraged families to have it be the dad day. So they started doing donuts for dads. And so they had, every Thursday was the dad drop-off day, and they encouraged dads to come in. And what was really positive about that is dads were they were lingering a little bit longer, so they were engaging with their child's teacher more. They were meeting each other and making those social connections with other dads, and also, more positively engaging in their child's early care and education. So donuts for dads is a really fun outcome of strengthening families. The other big driver of our work across the state is to focus on advancing accessible, affordable, and quality early care and learning programs and services. So this is of itself a whole presentation of really complex work of how we're advancing these pieces, especially quality. So Bruce talked about QRIS. I know many of you are also working on quality rating improvement systems in your states. But really what's important to know is that up until the last decade, there's really been no way across the country that we've been able to measure a quality classroom or know what quality looks like. So now, like I mentioned earlier, we know that it has to do with workforce and those quality teachers in the classroom, but it also has to do with how we're assessing quality in the environments, setting a pathway to improve quality for programs, and then also offering consumer education to families who are shopping for childcare so that they're more informed and can make good decisions. So I wanted to highlight a few of the workforce initiatives that we are focused on. As you all know, workforce development is a top issue that we have, seems like in all of our sectors, but in early care and education too. This is a huge challenge in early care and education. Typically, early care and education workers are paid some of the lowest salaries across the country. In Alaska, they make an average of $10.42 an hour with no benefits. So I don't think it's a surprise that that's attracting, an entry-level, low-skilled workforce. So that's a challenge because, as we talked about, the importance of early learning and the importance of, investing in supporting our programs, that makes it harder. There's also high turnover in programs, and in Alaska, there's an average rate of 42% turnover. So that drastically disrupts, important continuity of care and consistency for young children. We have two initiatives happening that are really excited to support workforce development that I wanted to highlight. One is the SEED registry. So many of you also have registries. Ours is called SEED, which stands for the System of Early Education Development, and it's really our career pathway for early childhood professionals so that they can be following a specific career pathway and to move forward. We also have wage incentives, which are really exciting. The state of Alaska has invested in a pilot project called the Roots program, which is a wage incentive to support that professional development and retention of teachers. And there's also a locally funded Juno initiative called Hearts, really focused on the same thing of helping to invest in teachers for that retention and professional development to support quality in our programs. Some promising practices that are unique to Alaska are, and Bruce talked about this too, are importance around data. And our data is really siloed at this point in Alaska and across the country. So we're looking at unique ways to look at automation, use technology, and bridge systems to best serve our young children. I think the question I get most commonly asked by people like you and our politicians is they say, I want to see the numbers, I want to see how this makes a difference, I want to see the positive outcomes for children. And that's a struggle, because testing is a big issue, of course you deal with all the time, but testing babies is an even bigger issue. And that's not best practice, and we're trying to figure out how to best support and show information about how to best support young children. We have some exciting public awareness campaigns going on across the state. I mentioned that Best Beginnings is doing some promotion around the 30 million word gap. They have a campaign called Words Count. And then I put a little bubble up there because Thread has a campaign happening right now called We're Ready. And that's a campaign designed toward parents so that they're ready and not rushed when they're shopping for childcare and taking the time that they need. The We're Ready campaign promotes some tools and resources that they can use to find licensed, safe, healthy, and playful childcare. I should also highlight their state and businesses are investing more, so there's some promising practices, I mentioned that earlier, and opportunities for some diversification in our funding and kind of innovative partnerships. Our state this last year extended its business education tax credits beyond K through 12 and higher ed to now include early childhood. So that's been an exciting new development in Alaska. So I'll close with just highlighting some of our challenges, which I think are not unique to Alaska and ones that we're all grappling with, and together I think we can come up with some exciting solutions. And as we heard earlier, I personally think one of our largest challenges with early childhood is that we have to consider the whole child and the whole family, and that's when just the peeling of the onion gets bigger and bigger and bigger when we're dealing with issues of poverty, housing, jobs, and so that's all really complex. I also encourage you to be, and I put this cute little picture of this baby up there because oftentimes when I'm talking about early childhood, people are like, you're talking about pre-K, right? And you're talking about Head Start, right? Like, I'm also talking about babies. And we often forget about the babies. So I have a funny story about that. I was meeting with the legislator this spring and started talking about the breastfeeding initiative that I just told you about. And he said, wait a second, you're talking about babies? I thought we were talking about preschool. And I said, we're talking about we're talking about everybody, like all of them, starting from birth. And he's like, no. He's like, I can get preschool and you got me on Head Start, but I don't go there. I don't go to babies. So I think there's still some work and information that we want to be a resource to you all. You have great resources here, to help you understand and for all of us to work together to figure out this very large and expanding, I would say, continuum of early care and education. So I'm not going to read these, but I think you're pretty familiar with some of these challenges. We've heard from Bruce already. They're complex, and Alaska is just one of 7 states that has not yet implemented and developed a QRIS. And so in some ways, many of your states may be more advanced in some of your systems, but this is where we're at with some of our current challenges. I also just want to say that there's really no silver bullet. I think a lot of people say, well, which one of these would you say we invest more in? And that's a really hard question to answer because we, firmly believe in parent choice and parent options and want people to have lots of quality selections and options when they're supporting their young children. So I'll just close with this picture. This is a picture of the Great Trans-Alaska Pipeline that you don't get to see while you're here at Anchorage, but it is here in our great state. And I often use the metaphor of the pipeline when I'm talking about early childhood because it begins at mile 0. It doesn't start at mile 5. And I want you to think of that when you go home because that's the same as children's learning. We don't start at kindergarten. They're starting from birth, and just like anything that we develop is needed. So when we think about innovations in education and how to best incorporate early learning, P3, pre-K, Head Start, all of it, it's really, the evidence supports investments in quality early learning and as those are really the building blocks for our healthy children, our healthy families, and our healthy communities. Thank you.